each one can tell me, what do you think the mission of Palestine Network? Number two, how you can help Palestine Network. And number three, how we can prevent diseases and problems in Palestine. And number four, how we can increase the available therapeutic aspects in Palestine. So these four questions, if we answer it, then we can tell the committee what do we think about this health care subsession and how we can insist on the higher committee to have an ad hoc committee or subcommittee of health care, because we don't want the higher committee make decisions without the advice of, one of us can be an advisor to the committee, not necessarily to the higher committee, not necessarily a member. If any one of us, which I encourage to run for the higher committee, will be our spokesmen for the healthcare. Because in my opinion, healthcare is the most important aspect in anything. Healthy people have healthy economy, healthy army, healthy people, healthy generations, spread the preventive aspects for a lot of diseases in America, in Palestine. So the first question is, what do you think about the mission of the Palestine Network? So each one can answer one question. We'll start with Mina. What do you think the mission, you thinking, what do you think their goal is?
Well, in my opinion, is really education, educating and upgrading certain aspect in the health profession. For example, setting up a kind of a database for certain medical conditions for everybody in Palestine, so that if an individual, for example, goes to, let's say, Al-Maqasid Hospital, and his name is entered or his number is entered, and he happens to be in Hebron, then his medical record can be brought up. And I'm actually working on facilitating that with a company that has developed software and is marketing it throughout the world.
أعتقد أول شيء المفروض نعرف شو مشاكلهم هون، يعني إحنا مش عايشين هون، نعرف شو المشاكل الصحية اللي عندهم كان بالمستشفى. بالضبط، نعرف أول شيء المشاكل اللي عندهم وعشان نقدر نساعدهم شو اللي بدهم إياه. أول شيء نعرف احتياجاتهم شو عشان نقدر نساعدهم. أعتقد هذا أهم شيء. يعني بنقدر نعمل فرقة منا اللي تلف على المستشفيات زي ما عزمنا الدكتور على المستشفى، نشوف شو النقص اللي عندهم، شو اللي بدهم اياه الاطباء، شو اللي بدها اياه الناس من الناحية الصحية، ونقدر نساعدهم فيه. وفي عندنا امكانيات، اعتقد الكل حسب ما سمعت عنده امكانيات يساعد في حقول مختلفة.
I just wanted to add, because I was reading this early this morning and I was getting excited because in my mind the mission is to bring Palestinians together towards building an independent, sustainable state, and I think that's the goal. And like from the Ministry of Health's perspective, we've been trying to work, and it's difficult because there's all these different groups and ad hocs, but we want people, Palestinians, to come back and serve in Palestine and work in Palestine and develop Palestine, you know, and this is the way you end up with a sustainable, developed country. And at the moment, Palestine is donor dependent. All the foreign aid comes. If the foreign aid stops, then everything else stops. The only way we can build a sustainable country is by ourselves, you know, working either from afar or here. But so that's what I'm.
I was going to address this issue actually in a different way. Since I was involved in the Palestine Network, and why we get excited about it is because actually it's want to transfer the knowledge and the experience for people from living outside and abroad to the current needs that they match what they need here in Palestine, and we'll be the conduit to do that kind of work. Because previously everybody was doing work on their own. They come into this place, it's unorganized, haphazard, there's no governmental support or somebody in a higher influence to make a change that's sustainable. Because everybody comes in, they do a diabetes center here, after 2 years, you know, I don't know what happened to it and it's gone, so you don't have the continuity. So for the first time, we have the Palestine Network that they can do this. And I think our work will concentrate in 3 avenues. First one is get the expertise and the experts, like everybody in their own specialty, to see what they need over here. And the needs are immense in every specialty, because I don't know the exact figure, But I think the Prime Minister Fayyad was saying that they transferred for care outside Palestine last year around 15,000 people. They give them to transfer them to go to Jordan or to Israel, to other places, to get their tertiary care center. So that's one need in everybody in their specialty, pediatric surgery or ophthalmology or what have you. They need that field. So that's one aspect, is to get the experts from outside to come over here and do certain things. The second aspect is educational. There's 2 or 3 universities that they teach medical fields over here, or the paramedical fields, either pharmacy or nursing and all that. So I think we can get lecturers and fields in education. They come in and give lectures either to practicing physicians to elevate the level of care to what are the standards in the Western Hemisphere. Not because I come from there, but the Western Hemisphere, they set the standards for the rest of the world in healthcare. So we need to tell them, like in diabetes, what's the standard of care? In emergency medicine and trauma, how do you deal with it over here? So these things, we can elevate the level of the care that's currently being developed over here from people who are experts in working on different protocols in the different fields. And I think the third aspect of it is, I wrote them down actually. The third one is medicine actually, which I think we worked on getting some medication over here. We work with pharmacists and people in other fields, try to get them in the different areas over here. They have medication from different parts of the world, but there are specific things that they don't have it. Like in oncology, they're always lack on medication because they're expensive and they cannot have it. And I don't know how many, last time I checked it, there is no, from my own knowledge, correct me if I'm wrong, there is no a highly trained oncologist that they serve the West Bank over here. And at one point, I think 5 years ago, they used to get somebody from Hadassah, they come over here, especially the Bethlehem area, and he used to put the protocols for giving the chemotherapy and all that. And I know a person who graduated actually from Jamiat al-Quds, from the first batch, that now doing his oncology training in Miami, and he's interested to come back to Palestine to start to work to establish a cancer center or cancer institute to give those things. I think these are the broad sections that we can elaborate on each of them. But this is how we can probably transfer knowledge and transfer expertise to what's needed here in the field on the ground.
I agree and the second, Dr. Ali Qutb, about the transfer of knowledge of what we have in the state. And I want to concentrate or give an importance for the preventive medicine.
When we talk about the mission
of our mission.
No,
yes.
the mission, how you understand the mission of Palestine Network and how you can help.
Yes. Yeah, to transfer the knowledge from the expertise in outside, from the United States or wherever, to the people here. And our mission to help them to educate people and increase their awareness about preventive medicine. Because I believe preventive medicine is highly important. Study, assess the needs of the Palestinian people and the community of the Palestinian people of the diseases, because every community has some environmental conditions that promote certain diseases or microorganisms. And accordingly, we plan what to do and what kind of programs we have to launch for preventive medicine.